When is the best time to go to the hospital? Now, this is the question that some of my friends have asked, some acquaintances have asked, and even family has also asked. And they come with complaints of, let's say, abdominal pain or chest pain or backache, or maybe, some fever and any sort of symptoms or signs that they exhibit. And these usually tend to message or call maybe towards the latter part of the day. Maybe it's around 3 p.m. or maybe towards the night. Maybe it's around 9 p.m. And then, their symptoms start to get severe and they find it quite unbearable to deal with it. Yes, we as humans take try to get courage and try to be brave in the face of any pain, saying, yeah, we can, get past this phase and we can control the pain and we can tolerate it. And, some of us take pride in it because we'd like to appear strong and get through life as being a strong person. But there are certain situations when you have to listen to the pain and you have to take action as soon as possible so that it doesn't get worse. And this pain can be anything. It can be, like I mentioned, abdominal pain, chest pain, back pain, neck pain. And most of the messages that I get are towards the later part of the day, asking, should I go to the hospital now? Should I meet the doctor, now when it's already later in the day? The reason why I'm talking about how important it is to go earlier during the day when you're dealing with some sort of emergency or some symptom is because the hospitals is well staffed during the early part of the day. It is a well-known fact that once the outpatient department is closed and once the emergency services start, the amount of workforce and healthcare workforce in the hospital is reduced by 70%, 70 to 80%. So let's say if you have about 10 nurses managing a ward during the daytime, towards the night you'll just find about two or maximum three. And this is how the roster works. And let's say if the nurses fall ill, or even if one of the doctors fall ill, the number of healthcare workforce that can assist you during that time is much reduced. So the level of care that you will get is also reduced. The maximum revenue of a hospital goes to the workforce. So they will have to manage the workforce in a way that has maximum efficiency. And doctors are not always available immediately because doctors are doing 100 things at the same time. They are busy looking at patients at different part of the hospital. They're running over diagnosis. They're trying to look at reports and see what fits or what doesn't fit, or running through differential diagnosis. They're liaisoning with other doctors. They're running tests, or they're probably doing surgeries, and they're probably managing a complication of what's already happened, or they are preparing the management for what is to come. And it's a difficult job being a doctor, being able to manage all of these things together. So while the doctor is doing all of this, and you probably go to the hospital at, let's say, 6 p.m. or 8 p.m., when you have a particular condition, and the doctor has already managed so much, and he or she has to give all of his attention to you. And with the resources and with equipment, and all of that may not be possible at off duty hours. So when you have some sort of a symptom, or when you are being affected by some sort of a pain, it is important that you prioritize it immediately. If you're at work, try and get away from work. If you're, planning to go somewhere, but have to change plans just to visit the hospital during the daytime, because one, the workforce is a lot more. The equipment works well. It is true. I mean, equipment, when you're using it on a few patients, on three or four patients, then it needs to be cleaned, it needs to be sterilized, it needs to be checked again whether it's working well. So all of this has a better chance of working if it happens during the early part of the day. Like I said, the equipment, the workforce, and the processes itself, whether it's, tabulating all of your documents, whether it's getting all of your documents together, whether it's preparing a treatment summary or preparing a discharge summary, or, getting cross referrals with other doctors, which is why it is important that you go earlier in the day, rather than later on, because your care will be affected because there are not enough resources to give you the right sort of treatment then.